Majority of voters oppose a shutdown over health care credits. What it means for you. A new poll shows that most Americans don't want the government to shut down because of a fight in Congress over health care funding. Here's what's going on, why both political parties are arguing, and how it could affect ordinary people. What's the fight about? The U.S. government needs Congress to agree on a budget to keep running. If they can't agree, non-essential services close. That's called a government shutdown. Democrats want to extend health insurance tax credits under the Affordable Care Act, often called Obamacare. These tax credits make health insurance cheaper for millions of low and middle-income Americans. Republicans oppose extending these credits. They argue that the extension might allow undocumented immigrants to get subsidized coverage, which they say is unfair to taxpayers. Because of this standoff, funding for the government is at risk, and the clock is ticking. What the poll found. A recent New York Times/Siena poll asked 300-plus voters. 65% said Democrats should not shut down the government if they don't get the tax credit extension. 27% thought a shutdown was acceptable to protect the credits. By political group. 47% of Democrats want to push hard, even if that means a shutdown. 43% of Democrats disagree. Only 32% of independents support a shutdown over this issue. Just 5% of Republicans think a shutdown is worth it. Who would get the blame? Many independent voters say they'd blame Republicans and President Trump if a shutdown happens. But the poll shows public patience is thin for both sides, meaning neither party wants to be blamed for closing down the government. Pros and cons of each side. Democrats' argument. Pros. Believe extending ACA tax credits keeps health insurance affordable for families. Argue it protects millions from losing coverage or facing higher premiums. See it as a moral issue. Health care should remain accessible. Cons. Forcing a shutdown could make the party look reckless. Some critics say focusing on the credits ignores the need for a full, balanced budget. May anger moderate voters who dislike shutdowns. Republicans' argument. Pros. Say the extension could cost taxpayers more money in the long run. Argue it might indirectly provide benefits to undocumented immigrants, which they oppose. Believe holding the line on spending keeps the government accountable. Cons. Blocking the credits could make healthcare more expensive for millions of Americans. Risk being blamed for hurting families who rely on affordable coverage. Could be seen as prioritizing politics over people's needs. How it affects ordinary Americans. If there's a shutdown, government workers may be furloughed, temporarily unpaid. National parks and federal offices could close or cut services. Delays in benefits and services like passports, loans, and some aid programs. If the credits aren't extended, many families could see health insurance costs rise, possibly by hundreds of dollars a month. Low-income families would be hit the hardest. Bottom line, the poll shows that while people care about affordable health care, most don't think shutting down the entire government is the right way to fight for it. Both parties face pressure. Democrats risk looking extreme if they push too far, and Republicans risk being blamed if they block health care relief.